12th-ranked Arizona State takes on the Redhawks of Seattle University in a non-conference baseball game tonight here at Phoenix Municipal Stadium. With Max Rossiter, I'm Tim Healy, welcoming you back to our broadcast. As they say in their advertisements carried during our ASU baseball game broadcast, the doctors and medical staff at TOCA, the Orthopedic Clinic Association, have proudly been serving as Arizona State University's athletic orthopedic care specialists for over a half-century. In addition to a staff of talented doctors in various orthopedic specialties, the staff at TOCA also includes physical therapists who help their patients recover from injury and rehabilitate after surgery in hopes of preventing future physical issues for those individuals. Joining us in the booth tonight is TOCA's Director of Physical Therapy and Arizona State University graduate, Alex Anderson. Alex, great to have you with us here tonight.
Pleasure to be here, Tim. Thank you.
Tell us about some of the most common injuries, and in particular some of the more baseball-related injuries that, as a physical therapist, you and your colleagues at TOCA deal with.
Well, the first would definitely be a rotator cuff injury, which is injury to the muscles that allow a pitcher to throw and create power. Second would definitely be the labrum, which is the structural stability of the shoulder. Mm-hmm. And third, everybody knows Tommy John, the surgery at the elbow. Very difficult, very challenging. And lastly, which we don't see as regularly, is ACL injuries in the knee. You know, you're sliding into home or you're running out, you step incorrectly, and you go down. That's a very tough one.
Boy, we almost thought we had a knee injury here the other night with Hunter Bishop, the Sun Devil center fielder, stumbling after making a catch in center, and luckily he was not seriously hurt. But it's amazing how quickly players can rehab after injuries. Talk about that.
Yes, and that's actually a tricky thing in the field now is as surgery is advancing, our surgeons are getting better, rehab people want to get better faster, and they anticipate getting back onto the field or getting back into play within the year. And as much as that it's possible, speaking to the common everyday man, some folks got to slow down. Mm-hmm. With our athletes, we push them hard, we push them fast, because being at the level they are, they've got to get back out there. When we do treat an athlete in the clinic, they're an inspiration to other folks who are rehabbing as well, because they're showing motivation, they're showing drive. And those athletes, as they drive on the field and they drive to strive for performance, they do the same in clinic, and it's very, very satisfying.
That must be challenging for you and your fellow practitioners, because you want to get these people better and you want to do it in the time it requires, but certainly athletes, as you said, have a sense of urgency about their protocol for getting healthy.
Yes, they do. And as much of a physical rehabilitation as it is, it's also mental, because these athletes want to be back on the field. And so we don't just treat them physically. We have to treat them emotionally and as an all-encompassing approach. And that's where, TOCA, where I've been working for about 4 years, mm-hmm. Celebrating 70 years in the Valley, we work with our physicians and all of our staff to make sure that athlete to common everyday person is getting the holistic care, and that we know if we progress something, they're progressing accordingly and not regressing it.
That is a unique aspect of TOCA. You have docs and therapists in the exact same building.
Yes, and that's part of the reason I work for TOCA is our physicians carry great names, but also I can go speak to any physician I need to or would like to. We carry a conversation, and it's not always about business. It's about each other and how we're growing each individually, and in combination getting our patients better, speaking about a specific patient. And like you said, I'm the head for therapy, so if anybody would like to get better faster, then give me a call as well.
It's great to have you part of our Sun Devil family here, Alex. Thank you for joining us this evening.
Thank you very much, Tim.
That's Alex Anderson, the Director of Physical Therapy at TOCA, the Orthopedic Clinic Association. As we said, they proudly served ASU athletics for over a half century, and they have been, and we are proud to say, sponsors of ours for many, many years on Sun Devil radio broadcast.